Investing in primary healthcare is the right and smart thing to do. We've heard time and again from our communities that this is what they want. They want trusted healthcare that meets their needs. The strength of a nation starts with the health of its people, which in turn starts with strong primary healthcare. My name is Dr. Rosebella Amihanda, and I work as a policymaker at county level to help expand primary healthcare systems across our region. My responsibilities include policy and policy advocacy, planning and budgeting for health services, and primary healthcare implementation. Globally, world leaders chronically underinvest in the foundations of health systems in favor of prioritizing a few specialized or time-bound issues, which means many people are not getting quality healthcare in their day-to-day lives. We need to stop jumping from one crisis to the next and instead invest in primary healthcare that can handle new threats and people's everyday needs at the same time. In Africa, our populations are quite rural. This means we need to invest in making sure we have quality, well-equipped facilities in the right places, with the right well-trained staff to take care of all the needs of the people and their communities. Policy and advocacy are important because it allows us to look at the bigger system and make changes in the long term that will have positive outcomes on the ground level in communities where healthcare may not exist at all. It means putting policies in place for sustainably financed primary healthcare that can outlast changes in administration and looking 10, 20, 30 years down the road. The Department of Health in Kisumu County is trying to ensure that the services that we offer are person-centered. And person-centeredness means that these services have to be responsive to the needs of the families and communities that we serve. Previously, Kisumu County faced a lot of inequalities in service delivery, such that the rural sub-counties had poor access to maternal healthcare services. With the current implementation of the primary care networks, these inequalities have been reduced, and the mothers who reside in the rural sub-counties are able to access comprehensive and quality healthcare services within their respective sub-counties. Trying to create a very responsive health system means that we need to be able to realize what ails the population. We cannot realize what ails the population if we do not collect the data from them. Kisumu County is privileged to have the electronic community health information system, where our community health volunteers collect data from the households as they visit. We are able to have summaries of the household health profiles, and should health profile of a particular region change, we are able to network with the link facility so that we are able to address the needs of that particular community. When we say we need a healthy population, it is not the absence of disease, it is actually the presence of good health. The biggest motivation I have in implementing primary healthcare is reduction of mortality, especially for the preventable conditions. By doing low-cost, high-impact interventions through primary healthcare, we should be able to prevent any unnecessary deaths in our communities and even in our county and even in the country. And therefore, this means that we shall offer a bright future for those that come after us.